nursing interventions. What is our goal as nurses when we're taking care of pediatric population respiratory distress? We want to decrease their work of breathing. Okay, we're going to support them in whatever interventions that we need to do in order to decrease their work of breathing. Okay, whether we need to give them O2, usually your first line is non-rebreather face mask or nasal cannula when we're supporting them. Allow them to rest. Okay, when we're going into assessments, try to group your assessment for someone who is having respiratory distress, because you don't want to always go in and not stress them up or wake them up and allow them to be crying and so on. Those are things to think about. What's the hydration status? Are they having really good really wet diapers? Do they have good urine output if they're a little bit older? What does their urine output look like? What is the color and the quality of their urine output? Family support. Is their family around to support them? Is there family around to support the family that's taking care of them in the child? And then is there any monitoring? What monitoring is needed for a child in respiratory distress? If you want to just go ahead and put in the chat. If you have, let's talk about this example. If you have a 9-month-old that is, let's say today we're in a community hospital and we are on the medical unit, and the medical unit has both pediatrics and adults. Now, if you have a 9-month-old that came in with respiratory distress, and they're admitted to your unit, what type of monitoring would you expect to have that patient on? And how often would you be doing vitals? So if you guys go ahead and put that in the chat. What you want to keep in mind is pulse ox. Definitely a pulse ox. You may do vital signs. If they're on a general med-surg unit, they may do vital signs every 4 hours as opposed to every shift. In the pediatric unit, but if a child is coming in for respiratory distress, then it's usually at minimum every 2 to 4 hour vital signs, and they will be on a pulse ox. Okay, you want to have them in a room that's close to the nursing station. If they're on the pulse ox, you definitely want to hear the alarms if the pulse ox machine is not connected into the main unit. Okay.